Agreed.
The curse of the expert, and this is, as I see this situation, and so many people kind of have hang-ups on telehealth. The curse of the expert is we get lost in our own head, and we live in our head as experts, and we forget where we've come from and how simple some of the advice is that we can actually dispense. And a scenario that I spoke to somebody about, I think it was yesterday, was picture your mother. Your mother's away right now. She's 3,000 miles away from you. She's in a country where healthcare is not great, and she slips and hurts her back. What's the first thing she does? She gives you a ring. And what do? You start to ask her what she did, how bad's the pain, what happens when you touch it there, and what happens when you move like this, and what happens when you do this. So you diagnose the problem. You say, Mom, it looks like you've got muscle spasm and tension, and this thing is, it is needing you to do ice or these exercises. If you've got any pillows in your house you can reach right now, and I'm going to start to give you some things that you can do. Most importantly, Mom, I'm going to tell you what not to do. And then I'm going to guide you through some exercises and watch you do them. And then what I'm going to do at the end of that call is probably give you a ring tomorrow and see how you are. And as I pointed out to that person, you've just done telehealth. And we take for granted how simple some of that advice is that we give people. And it isn't about our exercise as always. It's often just about the assurance that what has happened is okay, and that what is happening next is right, and that this person is on the road to recovery and doing the right things, which gives them peace of mind, like you said, reduces cortisol in their body and makes them feel better simply by knowing that they're doing the things that are not going to take them back over. That for me right now is all we're doing for patients. And it is, anybody who devalues that doesn't understand human beings, and they're more interested in their own skills right now than just getting into somebody's life and helping them. That's all we're doing. Nothing else is needed for this next 4, 5, 6 weeks. After that, the game will change when they have an abundance of choice and they can go back to their own lives. This becomes a different conversation. But right now, that's the fundamental basic situation that we're in, and the way that we can help people.
Yeah, beautiful. Yeah, everyone's done a FaceTime emergency call with a family member, right?
Exactly.
You've all done telehealth.
Thanks for watching this video. If you want to become a digital healthcare expert and provide your services to patients around the world, head to paulgough.com/telehealth to get full access to the Telehealth Income Explosion course. On this course, you have access to all of the marketing material to get your digital practice running, along with weekly live calls just like this. Again, if you want to become a telehealth expert while you're working in your clinic or from home, head to paulgough.com/telehealth. Thanks so much.